Hello everyone, my name is Sophie and I am a PhD candidate at the University of Hamburg. I'm based at Optimides, a population health management company in Germany, and my PhD topic is understanding behavioral changes to reduce low-value care. Did you know that up to 30% of healthcare spending today do not benefit patients and may even cause harm? In health services research, we define this as low-value care. It can consist of inappropriate medication use or unnecessary screening, tests, or procedures. In the US, where most of this research is conducted, it's estimated that between $75 and $100 billion is spent on low-value care annually. Despite campaigns such as Choosing Wisely, where recommendations on how to reduce low-value services is produced and disseminated to physicians, research shows that low-value care provision remains a top issue. My PhD research really centered around better understanding the determinants of behavioral change in reducing low-value care, with a specific focus around provider behavioral change. As a first stage of this work, I conducted a systematic literature review looking at the current evidence on physician behavioral change interventions and looking at what's effective in what settings for which outcomes. I found default and social effects to be the most frequently studied and consistently effective interventions in addressing low-value practices such as prescribing. Next, I used a novel approach leveraging the use of administrative data to map patient sharing networks, which allowed me to better understand the association between the centrality of a physician practice and their prescribing quality for elderly patients. Next, I collaborated with Professor Nicola Bella and Santana University as part of the HealthPros Network to further explore a series of different cognitive biases in low-value prescribing practices. In the study, we found that physicians prescribing is subject to a range of different biases, including loss aversion, equivalence framing, past behavior, decoy effect, in-group favoritism, and confirmation bias. As well, we used a discrete choice experiment to look at the relative importance of 3 different determinants in antibiotic prescribing. We found that patient expectations, while controlling for the 2 others, was among the most important determinant among hospital-based physicians in Tuscany. Lastly, using a controlled interrupted time series design, I quantified the decrease in unplanned hospitalizations among non-COVID patients, and specifically among ANI, stroke, and heart failure hospitalizations during the first wave of COVID in Tuscany. And to close, I share one of the highlights during my PhD, which is being caught in the COVID storm during my study visit to Pisa. And as you can see, I was well supported during that time, and even got to explore a different side of Italy during reopening. Thanks for your attention. I have included my email and my Twitter account if you have any questions or would like to reach out for further collaborations. Thank you.